you watch a film that involves life-changing situations like My Sister's Keeper, The Soul Surfer, or The Hunchback of Notre Dame, some of you might probably think those movies are heartwarming films. And they are. And some of you probably wouldn't think ever that anything life-changing would happen to you until it does. I'll be giving an informative speech on scoliosis. According to Medical News Today, or MMT, scoliosis is a condition in which the spine bends abnormally side to side, to the right and to the right or to the left. And here's how it looks like when it is an X-ray. And now you can see like the curve of the spine. According to WebMD, scoliosis most often occurs during the growth spurt before puberty. And the symptoms include the pain in the lower back, physical deformity, the muscle spasms, uneven with the waist, where the hip is slightly bigger than the other side, and it happens also with the shoulders, where one is slightly bent than the other, and your head is not directly centered above your pelvis. And also when you wear clothes, it might not like hang off your body properly. Also, in some cases, the heart and lungs may not properly function, and you might experience shortness of breath and chest pain. The individuals who get diagnosed with scoliosis is approximately 2% to 3% Americans who are to have scoliosis. The curvature of the spine is measured by percent, so the higher the percent is where you're more likely to have surgery. Females are more often to have scoliosis and be more affected by it than men, and women have the higher risk to have the worsening symptoms. People with scoliosis are more likely to have close relatives with the same condition than others. And the types of conditions of scoliosis are congenital scoliosis, which is caused by a bone abnormality present from birth. And neuromuscular scoliosis is caused from abnormal muscles or nerves. And there's degenerative scoliosis, which is caused by traumatic collapse or previous major surgical procedure, or osteoporosis, which is the thinning of bones. And lastly, idiopathic scoliosis. Idiopathic scoliosis is a common type of scoliosis, which the case is undefinable, so it is unknown. An article by Daily Mail, which is titled, I was terrified, I'd become a hunchback teenager, 18, overcomes agonizing pain and condition to become a model. The article is about Leanne Roberts, who is 18, who suffers from back pain of the scoliosis, and she is recommended to have a 12-hour procedure for her back and to fix her spine and to strengthen it, but she turned it down because she didn't want to risk ending her modeling career. Instead, she found relief exercises, especially for her muscles to strengthen her spine. The treatments for scoliosis include bracing and surgical procedure. Bracing is the usual treatment choice for children and young adults who have the curve between 25 degrees to 40 degrees. The purpose for bracing is to avert progression on the curvature and to have temporary correction. So you have to wear the brace so your curve won't become great. And if you take it off, the curve will return. The other treatment is surgical procedure. And surgery is for those who have curves beyond 40 degrees to 50 degrees. And according to Quest magazine, surgery will involve placing 2 metal rods side by side at the rear and attaching hooks at the top and the bottom. Surgery followed by immobilization and plastering, the plaster of body cast for many months, which allows the vertebrae to refuse together. The recovery after the operation, the patients are required to be on a respirator for 24 hours to 48 hours. And they would have to stay in the hospital for at least like 2 to 3 months until they have recovered. The reason why I chose scoliosis is to share what it is about and to also share my own personal story. I was diagnosed with scoliosis when I was 10 years old, and let me tell you, I experienced like everything that I have told you. I experienced the lower back pain, the sideways of the shoulders, and the displacement of the hips, and the pain is the worst. I had surgery when I was 13 years old, and I had surgery at Shriners Hospital here in Hawaii, and it took me a month to recover. The procedure took 12 hours alone, and they told me before the surgery that due to me like lying on the table for 12 hours front side, they told me that I might have a loss of sight. And